Hello, I'm Stan Lyken, the president of the board of the Rieger Foundation, and I'm here to introduce you to a Rieger Award winner. But first, let me tell you a bit about Dr. Rieger. Norbert Rieger was a child psychiatrist, but more than that, he was a man who cared deeply for children. He cared most deeply for children who, for one reason or another, came into this world with almost 3 strikes against them. He was born in Austria in 1908, and as a young man just out of medical school in Berlin, he traveled as a pediatrician to war-torn Ethiopia. He left that country when World War II was approaching. He went briefly back to Germany and then left for the United States. During a year in internship in New York City, he attempted unsuccessfully to liberate his parents from Germany. With the exception of one brother, they all perished. I think that disaster gave further fuel for his crusade to help children who are survivors of their own internal and/or external Holocaust. He came to California and became the director of the Children's Treatment Center at Camarillo State Hospital. It was there that Dr. Tange and I met him. We found Dr. Rieger managing almost single-handedly a children's unit with 75 to 80 of the most severely disturbed children I'd ever seen. The younger ones, 5 to 12, suffered severe autistic spectrum disorders, as well as mental retardation and schizophrenia. To watch Dr. Rieger with those children was an unbelievable sight. His patient tenderness and skill were an inspiration. We would watch, and as the sessions went on, we saw the spark in Dr. Rieger's eyes being mirrored in the eyes of those severely disturbed children. He saw no child as hopeless. He alone had transformed that snake pit he found upon his arrival into a vibrant, intensive treatment center. He attracted, hired, and trained teachers, nursing staff, and young psychiatrists. Most of us began to mirror his passion for these children. Unfortunately, he had no children of his own, but he designated that the Rieger Foundation would set up a series of awards to help inspire psychiatrists to work so that those children whose lives have been beset by serious emotional and neurological disorders might have a better chance in life. Those who may profit from their significant work may, in a sense, be the children whom he never had. Maybe they are the Rieger children. Dr. Rieger would be grateful to you for your work. Thank you and congratulations. I am pleased to introduce Dr. Jim Lackman, the winner of the Norbert and Charlotte Rieger Award for Scientific Achievement. The title of his paper is The Effects of the Mother-Child Education Program on Parenting Stress and Disciplinary Practices Among Refugees and Other Misaligned Communities in Lebanon. A pilot randomized controlled trial. Congratulations, Dr. Lackman.
Well, good day. My name is Doug Novins. I am a child and adolescent psychiatrist at the University of Colorado and editor-in-chief of the Journal of the American Academy of Child and Adolescent Psychiatry. And it's my pleasure today to introduce Dr. James Lackman, who's this year's recipient of the Norbert and Charlotte Rieger Award for Scientific Achievement. This is the highest recognition we give for authors of articles published in our journal. Jim is being honored for the paper Effects of the Mother-Child Education Program on Parenting Stress and Disciplinary Practices Among Refugee and Other Marginalized Communities in Lebanon, a pilot randomized controlled trial. The first author of this article is a colleague of Jim's at the Yale Child Study Center, Dr. Angie Panguta. In bringing this article into the journal and having the opportunity to do that with my colleague, Elizabeth McCauley, we were so taken with the work that we decided to write an editorial about it. In that editorial, we said, positive parenting, parenting that is warm, loving, and responsive to a child's needs, can mitigate the negative effects of early adversity and poverty on a child's behavioral, emotional, and cognitive development, and is one factor that can be targeted in otherwise almost immutable circumstances. Programs to support parents and to enhance positive parenting skills have proved effective across multiple countries and environments, including low and middle income countries. However, efforts to rigorously test these programs in areas of highest need and psychosocial instability are rare. By conducting a randomized controlled trial of the mother and child education program in 2 refugee centers and 1 low-income community in Lebanon, Jim and his colleagues defied this trend. Their work is an outstanding example of an effort to apply a rigorous scientific approach in a real-world setting, underscoring both the value and the challenges inherent in this work. Jim pursued his undergraduate work at the College of Worcester in Ohio and attended medical school at the University of New Mexico. He then joined the Public Health Service and served as a clinical associate at the National Institute of Mental Health before completing his training in child and adolescent psychiatry at Yale. He has served on the faculty at the Child Study Center since 1980 and was its director of research for nearly 20 years. He completed his PhD at the University of Sao Paulo in 2014. Jim, it's an honor to introduce you and congratulations on this wonderful honor.
Well, it's a pleasure and honor to be here. I'm just so sorry that we're not going to be meeting in person. It would be a real joy for me to interact with my colleagues out there in San Francisco. And I have the pleasure today to be presenting a presentation that actually is related to the Rieger Award that I had just received from the Academy. And the title is Pathways to a More Peaceful and Sustainable World, the Transformative Power of Children and Families. And I'd also like to begin by just thanking Doug Novins, who actually made the introduction, although he's not with us in the moment, but I'm sure he has a few things that he said. And I'd just like to thank Doug for his leadership with the Academy Journal, which he's recently taken on, also his work with the Native American communities across the United States in terms of really trying to make a difference in their lives, to say nothing of his work as the chair of the Department of Psychiatry out there at the University of Colorado in Denver. Well, you can also see on this first slide a few other things that I'll be briefly talking about, including the Early Childhood Peace Consortium, and I'll come back to that probably towards the end, and there probably won't be enough time to go through it in detail, but it's basically an organization that we started some years ago to try and build a more peaceful world. And it actually brings together people from UNICEF, from probably at least 10 different non-governmental organizations, and we have people that are actively involved really across the world. And I'll also be talking about our contacts with Links Initiative, and that's actually at the University of, or the Queen's University in Belfast, Northern Ireland. And if there's time, I'll tell you a little bit about that project as well. So typically, we need to sort of make disclosures, and I'm very fortunate to continue to receive funds from the National Institutes of Health. But in this particular presentation, I need to highlight the UBS Optimus Foundation and the Open Road Alliance, because they were actually the groups that funded this randomized clinical trial that was done in Beirut, Lebanon. And I should also mention, I'll be talking a bit more about the Ernst Strugman Forum. And this was something that we actually did in Frankfurt, Germany a few years ago, and I'll tell you about that in a few minutes. And interestingly, our next edition of the Tourette Syndrome textbook will be coming out with Oxford University Press next year. So I think with that, I will just move on and say, this is actually the book, and I'm not sure you can see it right there on the slide, but it was a wonderful opportunity for us to get together with, I think at least 50 other colleagues to really ask the question, if we make an investment in early childhood and parenting, if we begin in the early years, is there any chance that we will have a more peaceful world, more social cohesion? And it was an interesting conference because there were no presentations like the one I'm giving, but basically people were getting together and discussing issues from the basic science and what we know from animal studies and laboratory studies, all the way to social policy. So if people are interested, I'd encourage you to track it down. It's published in 2014 by the MIT Press. So one of the perspectives that I've grown to sort of feel very comfortable with over the years is that we're all interconnected in this ever-changing world of ours. And what's fascinating is that if you look at what's going on in the dynamics of social networks, it turns out that no one person really does anything. It's really only when you work together that you're actually able to accomplish anything. And that thing in the middle is actually just looking at social networks that are constantly changing, because that's what they do. And it's interesting too, because this award, although I'm receiving the award, there were so many people involved in terms of the children and the families, the people who actually did the implementation, the researchers that helped me in terms of crafting this, and I'll be mentioning some of their contributions in a few minutes. So it's fascinating too, if you look at the neurobiology of our brains, it turns out that no one neuron does anything. It's only when they're interconnected that it really makes the difference. And they're also constantly changing in terms of the synaptic connections that we have. And I guess one of the things that I'm even more fascinated by is that when you look at simulations of dark matter and dark energy at the cosmos level, and this is just a static photograph of the simulation, but it turns out that that's constantly changing too. So it's not just the interpersonal relationships or the neural circuits, but it's all the way out into the cosmos as well, that we're constantly changing and deeply interconnected. Some other perspectives I'd like to offer are people that I admire a great deal, Mahatma Gandhi and Nelson Mandela. If we're to teach real peace in the world, if we're to carry on a real war against war, we have to begin with the children. And Nelson Mandela, there can be no keener revelation of a society's soul than the way in which it treats its children. And I guess if we had more time, it makes me think too of Martin Luther King and the fact that he also was very involved in really trying to make a difference in the lives of children. It turns out that parenting is key and that the patterns of early caregiving matter. And I could tell you a story about each one of these photographs, but the one I want to focus on is the one down here on the lower side where my dear daughter Emily is holding our first grandchild, Caleb. And this is just in the hours after he was born. And I'd like you to take a look at the synchrony between their eye contact. And it makes me think of some of the work that I've been doing with Ruth Feldman over the years in terms of mother-child synchrony. But it turns out that parenting begets parenting. And it turns out that early childhood matters. And it turns out that the amount of data that's out there has really been accumulating. And this is just one of the many contributions that have been made with regard to early child development. And it was a special issue of The Lancet, Advancing Early Child Development from Science to Scale, that was published in 2017. And I was honored to be a co-author with my dear friend Pia Brito with one of the review articles focused on nurturing care. And you probably can't read it down here at the bottom, but young children's healthy development depends on nurturing care which ensures health, nutrition, responsive caregiving, safety and security, and early learning. So we could talk more about that if that comes up in the question and answer period. And this is actually just one of the figures that came from that review that I did with Pia. And it's basically focusing on what do we know in terms of the interventions across the life course. And we were particularly interested in ones where there was longitudinal data, where you could actually take a look at what was the program, what was the focus, and what was the impact, not only over the course of just a few months or years, but also over the course of decades or more. And it's interesting, too, it makes me think of James Heckman, who is the Nobel laureate in economics for the work that he did, because it turns out that in addition to the positive results of longitudinal prospective studies, there's also a clear economic benefit that supports the value to society of parent-child interventions in the preschool and earlier years. And this is just one of the figures that is fairly well known by James Heckman. And it basically is looking, when he looks at all of the data that's out there in terms of longitudinal outcomes that have been seen, if you have an intervention, during schooling or in preschool programs or programs that are targeted towards the earliest years, when do you see the biggest return on the investment with regard to human capital? And perhaps not surprisingly, it occurs in the prenatal and very early years. And of course, there is another reality, and sadly, many children in our world do not receive adequate nurturing care, and this reality is compounded by the situations of war, conflict, and migration, which families are exposed. This is actually a picture from Aleppo some years ago. But it's really pretty tragic what's been happening, and it makes me think we'll be talking about a program that was implemented in Beirut, and of course, all through the Middle East now. It's really pretty dreadful in terms of the amount of stress that folks are under. And more children than ever before, probably at least 400 million globally, are now living in areas affected by conflict. And in addition, every year, hundreds of millions of children are exposed to and are violence of domestic violence, and many of them are exposed at an early age. And of course, this is not just in developing countries and low and middle income countries, it's in our country as well. And of course, it makes me think of the sad realities now during the pandemic with regard to what's happening with regard to young children and their families. So this brings me to another colleague that probably people are fairly familiar with, but basically it's Jack Shonecroft and the Harvard Center for the Developing Child, where he's really focused on the importance of what is referred to as toxic stress. And over 200 million children under the age of 5 are likely to fail to reach their full developmental potential because they grow up in the context of toxic stress, whether we're talking about poverty, poor health and malnutrition, high levels of family and economic stress and exposure to violence, abuse, neglect, exploitation, and simply inadequate care and learning opportunities. And I guess as I've thought about the Black Lives Matter movement, I think any way that we can actually make a difference with regard to how the children are raised, how they are educated, what their opportunities are in a positive way, as well as making sure that they have adequate health care and nutrition, are going to be critical investments that we need to make as a society. So I think that the case for early child development has been made, and as a field, scholars, practitioners, certainly individuals in our field, in child psychiatry, but also pediatrics, public health, economics, education, are increasingly aware of the importance of ECD in setting the stage for the emergence of neurodevelopmental and neuropsychiatric disorders later in life, and that's something that I've looked at fairly extensively with regard to conditions like Tourette syndrome and obsessive compulsive disorder. But beyond psychopathology, it's also clear that events that occur early in a child's life can directly impact their physical health, learning and well-being, and the degree to which the child is able to reach their full developmental potential. And for me, the science of ECD conveys a message of hope and change, that if we're able to alter the context for young children, their life trajectories can be positively influenced. And this reality could not be timelier as our world grapples with the realities of the pandemic. And we need to elevate the agenda for young children and parenting, and these are crucially important actions that will serve to build a brighter future and a more just and peaceful world. So that brings me to talk a little bit about the projects that I'm currently involved in, and there are a number of international ones. I'll be talking to you in some detail about the one in Lebanon, and all the ones highlighted in yellow are currently ongoing. And they're using an intervention that was originally developed by Edward Ziegler, a professor here at Yale, that was then adapted by our colleagues in Turkey and the Mother Childhood Education Foundation. And it's their curriculum, their 25-week course, where they bring groups of mothers together that I'll be talking about in a bit more detail. But wonderfully, I've also been engaged with folks up at the Queen's University in Belfast, And there's a wonderful story that can be told about what happened over the course of time with regard to the conflict in Northern Ireland and how organizations like the Early Years actually made a difference in terms of bringing parents together from both the Catholic and Protestant backgrounds to help raise their young children. And it turns out that whenever you bring parents together, especially around young children, they're able to make a link with one another and want to continue to have that interaction, even though they come from very different cultural backgrounds. So I'll say a few more words about that. I'd also like to highlight an article that just came out in a journal called Development and Psychopathology, and this is actually in honor of Edward Ziegler. And I had the honor of of inviting my colleagues from across the globe to actually tell their stories about what they're doing with regard to early child development and what its impact is with regard to the societies in which they're living. And there's not enough time to go through it in any detail, but I did share the link, and hopefully when people download this presentation, they'll be able to click on that URL and actually see the actual paper in some detail. But those are all the ones that are sort of in an orange background are the ones where we are actively involved in doing pilot programs focused on early child development. And I'll now be telling you more about the work that we've been doing in Beirut, Lebanon. So this was a randomized clinical trial, and its goal was to reduce violence through the promotion of harmonious family relationships in primarily Palestinian refugee camps and in other fragile settings. And I could go through this in more detail, but I don't think there's really enough time to give it sort of all of the attention that it needs. But I'd like to introduce you to my friend and colleague, Dr. Ghassan Issa, whose picture is down there. And the picture that you see to the upper, I'm not sure whether it's left or right for you, but basically some of the group sessions where they have the mothers coming together to share their experiences and to go through the curriculum that this program has been offering. And so many thanks to Dr. Ghassan Issa and to the people who actually implemented the program, as well as, of course, each of the participating families and their children. Again, there's not an opportunity to take a look at this video, but basically, hopefully we'll be able to include that link. And it's basically, what's wonderful about it is that you hear the stories from the mothers about what the experience of going through the program was like for them. And although it's all in Arabic, it's also presented in terms of the subtitles that you can see here that Dr. Ghassan Issa is beginning, but I'm not going to go through that in any detail. But it is interesting because one of the things that the mothers realized that if they actually respond to their child differently, if they're less harsh in the way that they're punishing their child, they actually have a more positive and wonderful relationship with their child. And it's an interesting story. And I think I'm very grateful to Doug and the others that made the decision that this was something that the Rieger Award could help celebrate. So just in terms of the context, there are over probably 470,000, probably closer to 500,000 registered Palestinian refugees in Lebanon. There are also an increasing number of registered Syrian refugees, although there's no formal Syrian refugee camp. Many of them are actually living with the others that are in these very poor camps in Beirut that are primarily there for the Palestinian community. And to date, although this MOCHEF program that has been implemented, that was based on Ed Ziegler's program, has been implemented in Europe and really across the globe, there have never been any randomized control evaluations that have been conducted. And so our aim was to explore the impact on maternal knowledge, parenting practice, and disciplinary strategies in 3 marginalized communities in Lebanon. And these are the 3, and I don't need to go through them in a great deal of detail, but the Shatila camp and the Barajani camp are the ones where the Palestinian refugees live. So this was the paper that was just published in the Journal of the American Academy. So thank you again. Delighted that Doug Novins is here and part of the presentation. And the intervention is 25 sessions, and we had 50 dyads or 50 plus dyads that were randomly assigned to the MOCHEF intervention and 52 that were on the waitlist control group. And one of the things that I felt was really important was that here we're going to implement this program, but if we're going to implement this program and our families are randomized to sort of care as usual or waitlist control, let's make sure that they have access to the program after the clinical trial is completed. So that's something that we also raised funds for, so that we could actually implement the program for the families that were actually randomized to the waitlist control program. So the core curriculum includes a focus on child development, the importance of play, parenting practices, health and hygiene, and maternal empowerment. And what was so interesting is that as you listen to the discussions of the mothers, it really mattered the interconnections that they made with their colleagues. And interestingly, even after we finished the 25 sessions, many of the mothers wanted to continue that social interaction with their peers. And that's actually something through Facebook and through other means they've actually been able to accomplish, at least some portion of them for this period of time. And some of the significant outcomes that we got, whether we looked at all of the available data or just the ones from the individuals that had completed at least half of the sessions, there was a reduction in harsh discipline, and there was a reduction in the level of parental stress. And I guess one of the pieces that, and there have been probably 3 or 4 publications now that have come out about the clinical trial that we did. And interestingly, one of them was, the first author is Sasha Hine. And Sasha was with us at Yale, and then he was down in Texas before he went to Charité University in Berlin. And this is basically just a path analysis from that accompanying paper that was used, the data that we had from this clinical trial. And one of the significant effects that we saw was this reduction in maternal distress. But interestingly, the more engaged the father was, the higher the level of maternal recovery from distress there was. There was also a lowering of the maternal stress that she experienced, and there was a direct connection between the level of maternal distress and the maternal harsh punishment style that was one of the focal points of our intervention. So some of the lessons that we've learned are that the creation of groups of parents and children provides a promising opportunity to build social cohesion by bringing together and helping them interact with one another within families and communities. And one challenge is how best to sustain these groups over time. And as I mentioned, many of the mothers wanted to continue to meet even after the randomized clinical trial was over. And there is a need to engage more the fathers, because their involvement can make a positive difference, as I showed you with that path analysis that Sasha had done. This is just another paper that, for those of you that are interested, that I did with Catherine Pender-Brick and my good friend Kyle Pruitt. And both Catherine and Kyle are experts on fatherhood. And I am convinced that if we have a greater focus on the role of fathers, this will be a real game changer for our entire field. So that's another article that you might want to take a look at if you have the chance. So in terms of other next steps, we're currently doing a revised based intervention of the mother-child education program in Brazil, actually in 2 locations, one in a poor district outside of Sao Paulo and another one in the northeastern part of Brazil. Unfortunately, because of the pandemic, things are a bit on hold, at least for some of the aspects of that program. And there's also a revised MOCHEP intervention that's being implemented in Riyadh, Saudi Arabia, with over 200 families. And they're actually, both of these are randomized clinical trials. So it's wonderful that we're sort of moving ahead with these initiatives. Interestingly, Dr. Ghassan is also developing his own program now that he refers to as Health, Early Learning, and Protection Parenting Program. And it consists of a structured set of 15 weekly interactive training sessions where, again, the parents are coming together to have conversations, and both mothers and fathers follow the training together as a unit with their children being actively engaged as well. But then if we think about the reality, given the current unfortunate situation on the ground in Beirut following the devastating explosions, and here, I'm not sure if I mentioned it before, but I was amazed. I got the word from the Academy that I had received this Rieger Award, And about an hour later, I learned about the explosions that happened in Beirut. So it was just sort of this odd coincidence that occurred. But fortunately, Dr. Ghassan and his team are actively involved in developing and implementing virtual online programs for parents, children, and educators. And interestingly, he is now the regional leader of a group called the Early Childhood Development Action Network. And they're actually, because of the crisis that they're in, and it's both political as well as risk of violence and the rest of it, his Arab Network for Early Child Development is engaged in this family. They've developed an action plan to alleviate the suffering of families and children during this crisis. And it includes health and mental health services, things like distributing food and masks and diapers, one-on-one psychosocial support for distressed families. And it's interesting, too, we've been having these conversations, and actually Friday morning I'll be meeting with Dr. Ghassan remotely, too. We've been talking with UNICEF and how can we actually get the resources that are needed to make this a reality. And his action plan, he's basically asking for something close to $1 million for the next year. And what's interesting is that if people are interested, if you click on this URL at the bottom of the screen, you can actually see where you can actually donate funds to that initiative through this mechanism called GoFundMe. And the other thing I should mention is that wonderfully, this Rieger Award comes with close to $5,000. And I'm basically going to be giving that money to the Arab Network for Early Child Development once it's received in October. So this just brings me close to the end of my presentation. And it's interesting, and this comes back to the Ed Ziegler story and the rest of it, is that oftentimes when you're talking to policymakers and sort of decision makers, they're much more influenced by personal stories than they are by the numbers and the data. And so this theory of change is something that we've been developing when we actually go to talk to people, because we're trying to get a resolution through the UN with regard to the importance of early child development and peace building. And this is the kind of theory of change, but we also include with it narratives that people can provide in terms of the impact that these programs are having on their lives. But it turns out that early exposure to toxic stress leads to societal risks, and the whole issue with regard to inequalities across cultures, and genders, the loss of social cohesion, decreased trust, increased rates of violent crime, intergenerational cycles of poverty, unemployment, higher expenditures for child protective services, education, healthcare, as well as the criminal justice system. And it's interesting, too, if you go back to that work of James Heckman, it turns out that one of the biggest reasons why there's such a big important impact financially and economically with regard to the early child development programs is that there is less criminal behavior by the individuals who actually have participated in it. And there's actually fewer incarcerations. And it turns out that incarceration is really a very, very costly endeavor. So in this theory of change, if governments, institutions, organizations design and implement early child development programs of proven value that build on context-specific, peace-relevant attitudes, skills, and knowledge in children and families and government institutions, then there will be increased vertical and social cohesion and a reduced risk of intergenerational transmission of violence, increased economic growth and sustainable development within communities at the national and international levels. So the take-home message is we need to take action to make our world a better place for our children and for future generations. And next steps include a commitment to refine, adapt, and implement in a sustainable fashion early childhood development programs of proven value across the globe. So I mentioned the Early Childhood Peace Consortium. I would hope that you would actually look up our website. These are some of the people that are actively involved. There's another picture of Pia, who actually helped us start it at the UNICEF headquarters back in 2013. This is Rima Sala, who's actually the CEO currently for the Early Childhood Peace Consortium. And then the people who are actually actively contributing to the development of the site are Shimra Fallon and Hans Hartl, who actually remarkably is the person who's in charge of web design here at Yale. So with that, I'm just going to say many thanks. And these are some of the folks that are involved that I didn't really have a chance to say a whole lot about, but certainly very involved is Links Network, Paul Connolly, as well as Siobhan Fitzpatrick, among others. So with that, I think I will say thank you. And if there are any questions, I'd be glad to answer them. But the person who really should be getting this award is Dr. Ghassan Issa. And I must say my younger colleague, Angie Portuga, is actually leading the effort to get the funding for the program, is the first author of the paper and really contributed a great deal. And interestingly, she's originally from Colombia, and she's very involved and active in programs around the globe, including ones in Colombia, as well as Pakistan and other countries around the world. So with that, I will say thank you very much, and hopefully there will be a few questions.